typically see this in younger athletes that have a more pliable chest. Baseball is a culprit, but martial arts, it happens and things like that as well. What that is whenever you get a blow to the chest that's hard enough to disrupt the normal rhythm of the heart, and it hits at a certain part of the electrical conduction in the heart and causes an arrhythmia, or in this case ventricular fibrillation, where basically the heart is no longer functioning properly and it can't get enough blood to the head or the brain. It is very rare, especially in a full-grown male athlete with padding, but it does happen. Should we play football? And there's risk in anything that we do. There's risk in all sports. There's risk in not doing sports, long-term things, if you're not healthy and things like that. So you always have to weigh the risk-benefit. And is football more injury-prone? Yes, theoretically, but there's a lot of injuries seen in lots of other sports. The response that team had was very quick. If you go back and look some of the other cases, they don't assess quickly and they don't treat quickly. And that's why I think there's been a push to get AEDs on site. You have an emergency action plan. As a sideline physician, which is one of my jobs that I do for football, is to be there for that type of thing. Either if it's a heart problem, is it a head problem, is it a bad break or a cervical neck or something like that. We're there to help implement that action plan and get something happening quickly so we can escalate that to higher care. We have athletic trainers that are at some of the different schools. We'll have a preseason meeting where we go over how to spine board, how to recognize some of the really emergency type protocols and things like that. We go over our emergency action plan, and they should do that with their school, and they should practice just a drill on the sidelines to make sure that everybody knows who to call, what to do, where's the AED, and go from there so they can escalate to higher care. If it's something that requires surgery, it can be several months out. If it's something heart related, typically that would be something we may catch on our pre-participation physicals or some type of family history. So we would do some type of workup with either a cardiologist before we let them return to play, depending on what it is. You get into things like concussion and things like that. It depends on the injury, whether or not we get them back. And we go through protocols that have, evidence behind them of how to get athletes back safely. It's scary to see. I think in the NFL, we've definitely seen some of the worst type of injuries that can happen. But if you think about the popularity of that sport in this country, there's a lot of kids and a lot of people doing it. So the chances are low. So low that I think it's important to keep kids in athletics of some type and get lifelong relationships, lifelong exercise regimens and things like that. And I think one thing you have to think about is your pre-season conditioning and things like that, making sure that your protective equipment actually fits properly and it's up to date and approved by all the governing bodies. But definitely there's off-season training, there's weightlifting, there's conditioning, there's drills and things like that, and staying healthy. That also goes into eating properly, hydrating properly, sleeping, all of the things that we should do all the time just to stay healthy.